All right, folks, in Michigan, there's a state-led response to the lead water crisis in Benton Harbor. Of course, we told you about that yesterday. Lieutenant Governor Garlin Gilchrist said the state is providing Benton Harbor residents several resources amid the water crisis in the city, including an ambitious plan to replace the city's lead pipes. Joining us now is Reverend Dr. Don J. Tynes, the Public Health Director for Benton Harbor. Doc, glad to have you on the show. How did we get here? How did we actually get here with these pipes? Whose fault is it? Was this simply natural? What happened?
It's not natural, no. This is an event that started out in 2015. There was a research study that was done in 2015. There was interaction between the city and the state. At that time, EGLE was called the Department of Environmental Quality. 2017, they notified the city. 2018, they did a follow-up notification. Then after that, 2019, the commission and the city residents became aware that there was an issue. You had an activist named Reverend Edward Pickney, who formed a Benton Harbor Community Water Council that went out to work with the city, Mr. Michael O'Malley, who ran the water department at that time, to go out and to do testing. And the testing revealed that they had some higher levels than Flint, Michigan itself. And so that caused an action item. And then at that time, all I can say is that history kind of repeated itself, and that we in the city thought that it was better than what it was, but it wasn't. And as a result, we did the exact same thing that Flint did. We made the exact same mistakes that Flint did. And the people got exposed to lead for several years. The action items started where individuals were given water filters. The water filters, initially they were just being given, but then the Benton Harbor Community Water Council, what they did is they asked the people, did you understand the directions on the box? And if they said no, they tried to explain it to them. If they still didn't understand, then they actually personally went to their homes and installed them, and they would follow up in 3 months. Now, what happens is that you find in America systemic racism is prevalent. So the water filters came from the state, went down to the county health department. The Benton Harbor Community Water Council received credit, which is predominantly African American and youth that are doing this venture. And the county did not receive the recognition, and therefore, based on emotional response, they shut down the whole water filter program. Even though the lead was still there, the crisis was still there, and the people were still exposed. And so now, after the efforts of Reverend Pickney to work with the EPA, to work with EGLE, and to work with the governor to bring this up into a higher level of awareness, that we have the efforts. Also, what happened at that time was that a company called Bon Marché, which is also called Adamarsh, for some reason told the city that they would fix the problem if the city raised the water bills, and that they will do it over a 20-year period. And what happened is the city commission agreed to 20 years of poisoning. That has been an issue, but to help the city out, because of their inexperience, the governor actually stepped in and said we can replace the 4 mile by 4 mile city probably within 1 year, and fought and got the Republicans to buy in to give money to actually replace the water piping. But it was told that the company, Bon Marché, did not have the resources in terms of personnel to do it. And so the deputy mayor, or Mayor Pro Tem Dwayne Seeks, requested that Reitman and Associates be added on as an engineering company so it could be done in half that time. So the governor wanted it in 2 years, so the compromise was 5 years, and now with Reitman and Associates to be coming on board, so maybe cut it down to 2.5 years. But then there's actually a third company that's involved in others, so that that we should be able to do it less. Bon Marché, is a response, what they did for the first time ever in decades, wind up having African-American contractors have a meeting so they actually know, after all these 20 to 40 years, that there was African-American contractors, and found out who they were that could have actually assisted in this problem. And so what you have to do is look at the systemic racism that's permeating through all out cities, that the only reason that there's an interest right now is because there's money. And so money brings interest. And before there was no money, there was no interest. And so that the African American people have suffered. And what we've found that we have found lead in patients in terms of kids, but for the first time, I actually found lead in an adult, and the patient presented with mental status changes in terms of memory, elevated blood pressure, some what we call some kidney insufficiency, and then what also was noted was that that I checked the lead level just to be on the safe side exposure, found out that she had a lead level. So I talked with Dr. Walter Davis, who ran the whole Wayne County, Detroit lead poisoning program, and he was alarmed because you should not be lead in an adult because of the size of the person, that it should totally be absorbed by the tissue and nothing in the blood or in the serum. And so a level of even 1 or greater shows a massive amount of exposure to that of 10 or 15 that you would find in a child, which would make you want to do IV or chelation therapy. So we have adults, and they were missed. The adults were overlooked and missed in Flint, even though they were living in the same house, even though they were drinking the same water, that no one cared about the adults. And so what you find in Flint now is there will be individuals that who are adults have it. Now, you know that in terms of environmental justice, that anytime you go into an African-American community, a minority community, you're always going to find the presence of special lead. And what you're going to do when you look in the community for special lead, you go to the educational system and you'll see that they have a special lead program. And that special lead program is called special ed. And those are a lot of times your victims of lead.
So we talk about how we got to this point. First of all, it's crazy that you have city officials agree to replace them over a 20-year period. I mean, literally, a child born would be an adult by the time they're actually done. That's malpractice within itself. And so, are we actually going to see the work done? Is the state intervening, saying, no, we're going to make sure that this gets done, and you don't have all the shenanigans going back and forth?
And that's what I was pointing out to, that they had agreed to 20. And then the negotiation is that the companies are being forced that one company cannot do it, and they have to break up that monopoly. That monopoly of that one engineering company goes back more than 20 years. So you're talking about a 20, 30-year monopoly, even though right outside, a mile to 2 miles outside of the city are other engineering companies that are doing it. And their sister city, which is the predominantly white city, hired a company who's going to do it within a year. So in a white community, it's done within a year, and the African-American community is done within 20 years. So you have to explain that. So the governor had to intervene. So Governor Whitmer said, we got to help this city out, because that doesn't make sense, like you just said, because there's no acceptable lead level in a human body, especially in a child. So she's the one who's advocating to try to get it done. She's the one who's advocating now to try to get it done with maybe in 6 to 12 months, that you really push it hard. So that's coming actually from the governor's office, personally from her. And I can't say, from what I understand from speaking with Reverend Edward Pickney, it's more the governor effort than the lieutenant governor effort, that she's the one who's spearheading, trying to make up for the accidental misunderstanding of the Benton Harbor City Commission. So the City Commission made a gross error. City Commission did not respond after learning from the lessons of Flint. So we have that young and inexperienced situation, or history repeating itself. So if Malcolm X said, history best rewards all research. So if you don't study history, then you're going to make some of the same mistakes that were made in the past, and so your progress is less. But if you study history and know the mistakes, then you can skip those mistakes and learn new mistakes, but you've been further in your progress.
Well, it is unfortunate to listen to this. Black folks have been greatly impacted, just like in Flint. We're going to have Mayor Mark Muhammad on tomorrow. They reached out to us to talk about this. And so, hopefully the work gets done and the people don't have to sit here and drink bottled water and listen to these admonitions of doing nothing. I mean, not being able to use the water, take showers, baths, things along those lines. That just makes no sense whatsoever. Done.
But I must say this, that I need you to make sure that you also reach out to Reverend Edward Pickney, because he is the one who brought this to the forefront. He's the one that the governors talked to. He's the one that Eagles talked to. He's the one what EPA brought to. That came from a community activist point of view. That was not city related, city ran or city promoted. And all the water that's actually coming in now is directly related to that Benton Harbor Community Water Council, which he is the president of. He pushed a hand. He put in a petition. He's the one who's threatened to do the lawsuit.
No, I got you. No, but see, I want some answers from the city, because what I want to know from the city is, why did it take all of that? That's what I want to know.
Yeah, you're going to have to ask them that.
And trust me, I will.
Mm-hmm. So what you find is that here the people need to know two things. One, that you can, as a person, as a community activist, you can make a change, make a difference. The thing that happened in Flint, there was African-American doctors who notified that this was a problem with Flint, but it took a non-African-American pediatrician to speak up when they say this was a problem. And so now you have to deal with that issue. The second thing is that adults need to be tested as well as children, because they've been exposed, and you're not going to see it in the blood because it's already absorbed in the tissue, but you're going to find them. They're going to have headaches that they cannot explain. They're going to have memory problems that they can't explain. And people want to throw it off to Alzheimer's. They're going to have elevated blood pressure. They're going to have kidney disease. When you look in African-American communities, you're going to find dialysis centers that may be your kidneys-related centers, like you have special ed, which is special ed in the community. So we may be seeing the ravages of lead in these communities. A prison study showed that they looked at the African-Americans in prison, and they looked back and they found that in infants they had been exposed to lead. And then in Wayne County juvenile system, they're seeing that individuals who are going up for murder that haven't been exposed to lead. So we have to really look at this. But the bright side is that the people who've been injured by lead, if you give them special concentrated efforts, they actually excel those who have not been expelled. The body tries to overcompensate in helping them to learn, but in our special ed programs, once we put them special ed, that special ed, that wouldn't have been especially dead, and that we don't really do any efforts to try to enhance their academics. So we need to increase their academics, we need to test the adults and the children, and we need to do that now.
All right, Doc, I appreciate it. Thank you so very much. Keep up the good work.
Thank you, sir.
All right,
it was an honor to be here.
Thank you very much. Got to go to a break. We come back. Back to our Roland Martin unfiltered video in just one moment.
Once upon a time, there lived a princess with really long hair who was waiting for a prince to come save her. But really, who has time for that?
Let's go. Feeling myself. I'm feeling
She ordered herself a ladder with Prime one-day delivery, and she was out of there.
I want some hood girls looking back at it, and a good girl in my tax bracket.
Now, her hairdressing empire is killing it. And the prince? Well, who cares? Prime changes everything.
Time to be smart.
Roland Martin's doing this every day.
Oh, no punches!
Thank you, Roland Martin, for always giving voice to the issues.
Look for Roland Martin in the whirlwind, to quote Marcus Garvey again.
The video looks phenomenal, so I'm really excited to see it on my big screen.
Support this man, Black Media. He makes sure that our stories are told.
See, there's a difference between Black Star Network and Black-owned media and something like CNN.
I got to defer to the brilliance of Dr. Carr and to the brilliance of the Black Star Network.
I am rolling with Roland all the way. Honored to be on a show that you own. A black man owns the show.
Folks, Black Star Network is here.
I'm real revolutionary right now. Roland was amazing on that.
Stay black. I love y'all.
I can't commend you enough about this platform that you've created for us to be able to share who we are, what we're doing in the world, and the impact that we're having.
Let's be smart. Bring your eyeballs home.
You can't be Black-owned media and be scared.
You dig?